Welcome to Insights. I'm Dick Goldberg. All of us have certainly had or certainly will have the experience of losing someone close to us. We'll all experience the process of grief and grieving. On today's program, we'll learn what is a normal, healthy grieving process and perhaps when we may need to turn to a professional for help. With us is Dr. Emely Verba. She's a clinical psychologist. Her father's death while she was in grad school triggered her interest in this area. Her doctoral research was on the effects of social support and bereavement. For 24 years, she has specialized in this area and presents seminars regularly on grief to the psychiatric residents at the University of Wisconsin in Madison. Emely, thanks a lot for being with us.
Thanks for having me, Dick.
Why do we grieve, and what happens if we don't?
Why do we grieve? Grief is the price that we pay for loving. We're social animals, and we form attachments, and it's a natural process that when we lose someone that we're attached to, we grieve. Animals grieve as well.
They do?
Yes.
How do you know?
Oh, there's a lot of research, actually,
Wow.
to support that in terms of elephants and monkeys. Even crows have some grieving rituals. So
Without the help of therapists to get them through it.
Well, that's true.
What happens if you don't grieve and you have a big loss?
Yeah, thank you for that question, because I often tell people that if I had a magic wand and there was one thing in the world I could change, it would be to say that if you just push grief aside and wait long enough, it would go away. And unfortunately, it doesn't.
Why not? I mean, I think someone dies as close to you, 5 years pass, gone.
If you process the grief, it does tend to recede, and I can't say that it entirely goes away, but it becomes very tolerable or livable.
What are we talking about going away when you say grief? Do you mean sadness? Do you mean depression over the loss? What doesn't go away?
I can't say that it's a specific emotion, but it's a feeling in your heart as well as your thoughts in your mind, and really your attachment to that person that you've lost. The attachment doesn't necessarily ever go away, but the painful feelings or perhaps the obsessive thoughts and yearning will recede. And that is then when we say you've accomplished healthy grief.
Okay, well, let's go backward to the person who really is, they haven't processed grief as you would like to see it, is healthy. They walk into your office, I don't know how they get there, what prompts them. What are they experiencing? What are their symptoms of not processing their grief that you have to help them with?
Well, they may not be walking into my office with grief on their mind. So I think of one experience that I had when I was working with parents regarding a teenage daughter. And in the midst of our session, it became apparent that they had lost a daughter to SIDS 17 years earlier. When we opened up that piece of information, it was like it happened yesterday.
Wow.
And the pain was just palpable because they had just closed that door and put it aside.
Well, for those 17 years then, what were they experiencing that they wouldn't have if they had sobbed and grieved for a year after that loss?
I think that there's kind of a repression, and in some ways that is protective. So they may not have been experiencing something during those years. It's just that it stayed with them. Okay, people can go to their graves with unprocessed grief.
Well, when is it a problem if it's unprocessed?
Life tends to have a way of opening up those doors that we'd rather keep closed. And you're vulnerable if you have these shut off places of your heart and your mind that that can be opened up to really intense pain.
What I picture is that a lot of people who don't process the grief, don't cry or whatever, have depression. That it's depressive to their being. Is that accurate?
It may or may not be.
Well, how else?
Yes.
Okay. Depression is one possibility.
Depression is absolutely one possibility.
What other downsides, if you don't grieve, might come up to bite you?
Not opening fully and living completely.
So being sort of depressed but not clinically depressed?
You know, I think anytime you have shut off places of yourself, that's not necessarily psychologically healthy. So, you know, they can come up in dreams, there can be triggers of seeing other people who have a loved one that maybe you've lost. That acuteness of the pain still remains inside and can be triggered anytime.
Okay, so if it's not like all of a sudden really missing the person who died, it could be depression. What other symptoms might come up that wouldn't have come up if you had gone through what you're about to talk to us about, the healthy grieving process? What other symptoms?
Anxiety, fear of more losses. Sometimes almost a PTSD situation where something that might recall a loss can trigger a very panicky.
Okay.
Yeah.
How about fear of attachment?
Oh, absolutely. Absolutely. You know, the heart and the mind are saying, I'm never going to get hurt like that again, so I just won't attach.
And if you had gone through the healthy grieving process, again, you're about to tell us about less likely you'd have the fear of attachment.
Much less likely. Okay. And if you do have the fear of attachment, you're able to work through it. Yeah.
Okay. Well, why don't you shed some light on what is the healthy grieving process? Is it step 1, 2, 3, 4, 5? What is it?
Thank you for asking that. There is a very widespread notion that there's a linear process of grief. I see it all over and applied to all kinds of things. The 5 stages of grief that are said to be denial, anger, bargaining, sadness, and acceptance.
That sounds like Elizabeth Kubler-Ross in terms of when you are told you're going to die and go through those 5 stages.
Exactly, and that's where they came from. Kubler-Ross, who is brilliant, found that those stages referred to people who learned that they had a terminal illness and knew they were dying. And they still are very applicable to that process.
Give us those 5 again. They went by pretty fast.
Okay. I'll give them to you, but I don't want to reinforce them because they are a myth. Okay. They are not
Are they
the
a myth
grieving
in terms
process.
of death and dying as well?
No.
Okay, just in terms of the grieving.
Just in terms of grieving.
Okay. So why not give us the 5 and let's reiterate, you don't believe these are the 5 in this order.
Okay.
They are
denial.
Yeah.
Anger.
Okay.
Bargaining.
Yeah.
Sadness or depression. Acceptance.
Okay. Now, tell us what you see as the reality for grieving.
Thank you. There's a wonderful. First of all, that old model implies a sort of linear progression of grief, that you go through this stage, then this stage, then this stage. We've thrown out that whole stage idea.
You say we have. Who has?
Professionals in the field who have studied grief.
Okay.
Okay.
So the data and the research supports what you're saying.
Exactly. I particularly, one of the researchers, William Warden, just an expert in the field, and what he talks about is a task model for grief, which means that there are these parallel tasks that occur during the grieving process, each of which must be accomplished to kind of work through and get to the end of the grieving process.
Okay.
So I've applied an acronym just to help me remember them, and that is AWARE, A-W-A-R-E. And so the first A stands for acceptance of the death. That sounds really easy, Dick, but in fact, it's complicated. A person can know in their mind that someone died, and yet the reality doesn't sink in right away. So even after a funeral, they can be at home and almost expect the person to come around the corner and still be there.
My mother died, it's 5 years ago. Okay. And every once in a while, if there's something that occurs, I go, she'd really like to know that. My first reaction is, I got to tell my mother. And within about 5 seconds, she's dead. But yes. And I don't think I have a problem, but even then, that still happens.
Exactly. And in the early phases, shortly after the death, that is really very prominent for a lot of people. There's a sense of it being surreal. Like, did this really happen? Is that person that I loved really gone from this earth? So helping people to become aware of that and to, kind of confront that painful reality that, yes, in fact, that person, you've lost the physical essence of that person.
Yeah, I mean, they died.
That's right.
Cognitively.
Right.
But somehow emotionally, you don't accept it.
It takes a while for the reality to really sink in.
Yeah, okay.
Okay. The second W part of the task models is working through the emotions of grief. And so, again, in contrast to the old model, which says you go through a series of emotions in a certain order, that's actually very far from the truth. What happens is people who are grieving experience a number of emotions almost concurrently or within the same hour. So sadness, of course, is there. Anger is very often there. Guilt is there. Anxiety, fearfulness is there. So, and again, those may switch. It may feel like people are feeling all of those things at one time, or they may switch every 5 minutes. And each of those emotions must be worked through and experienced.
Let me flesh that out a little bit.
Sure.
Let's say you lost a dear friend. Why would you be anxious? Sad, I understand, but why anxious?
Possibly it could happen to someone else that you love. Possibly it could happen to you.
I see. Okay.
It confronts your own mortality anytime someone you care about dies.
Let's take a side path for a minute. We'll come back to it.
Okay.
How often do you see people who are upset when they lose someone close to them because it triggers their own fear of death and their own reality of mortality?
I can't say that that's the most prominent reason why someone would come into my office following a death. It is more often the emotions of anger, depression, and guilt. I could have, should have. What did I say at the last time I saw them? It's really kind of amazing how people find things to feel guilty about.
I think we want to talk about that a little while and a little later as you review this. I think that's a very interesting area, the guilt. But why don't you continue? So you have to work through the emotions of anxiety and guilt.
That's the W.
Okay.
The next part, the next A, is adjusting to life with the reality of the person gone. So there are life tasks. If someone loses their spouse, they've suddenly not only become a widow or widower, but they've probably become a single parent. Now, this is a huge adjustment and change. I mean, we think about it with older people where one person may have taken care of the checkbook or one person mowed the lawn. But, of course, I work with grief across all age spectrums. And particularly in earlier years, there's an essential working relationship that exists. I needed to call my mother for advice about my kids. She's not there anymore, right? One income versus two incomes. So those are sometimes the ones that kind of hit with full force and interfere with actually dealing with the emotions. Because life goes on and the grieving person has to struggle just to go to work if they had a job.
So this isn't part of your job, if you see someone's trouble with grief, of helping them work through these actual things of life as much as the emotions they're not dealing with.
Oh, no, I very much consider it part of my job. It's making suggestions about where can you get support, and can you talk to your boss about this, and, what are the pros and cons of staying in the home, and how do you make those decisions, and can you defer those decisions? So oftentimes people are really inundated with just how to cope with everyday life, and that's a part of the grieving process where I provide support and hopefully some suggestions, not making decisions for people, but helping them to know that these are really hard things that they're coping with.
Okay, I think it's helpful if you repeat again what AWARE stands for so we see where we're at in this process now.
Thank you. So A is acceptance. W is working through the emotions. A, again, is adjusting to the environment. Okay.
And now we're on to R.
R, it's an R-E. Okay, so it's the fourth task. And this is a really interesting one. It refers to the words relocate emotionally.
Oh, my.
Okay. And when William Worden was first developing this task model, interestingly, it first used to refer to, he used to say, people withdraw the emotion of invested in the person who is deceased and reinvest it in moving on. They changed that because they find that people don't necessarily need to withdraw those emotions about the person that they love. They need to work through the painful emotions. But in fact, our love and our attachment can endure beyond death. And so the idea of relocating that, finding this essential connection that someone can have vis-a-vis memories, spiritual beliefs. People can feel that they will connect again with the person they lost after their own death. Or sometimes something as simple as people will get a tattoo. I find that when people lose a child, that's one of the things they opt to do as a way of feeling that there is an ongoing permanent connection.
Does that help them somehow let go to have that tattoo? Like, now I've taken care of Billy or whatever, they're there with me and I can let go of my obsession over my loss? Or?
Yeah, I wouldn't say that that's a process of letting go. In fact, when I explain that fourth task, the words that I often use are holding on and letting go.
Okay.
And needing to do both. Okay.
It's a confusing thing because if you're holding on, it sounds like you're not letting go.
You have to let go of some things, like the physical presence, the ability to pick up the phone and call your mother.
Sure.
Right? But you can hold on to the love you had for the person. You can hear what they might say in your mind. Oh, if so-and-so were here, they would do that. Right? On occasions, there can be this sort of heartfelt sense of the presence or the memories and the old connections with the person who's died. That's the process of holding on, and that piece of it is healthy.
So, this might sound a little insensitive, but it sounds like what you want to do there is eventually keep the good in the deceased that you can and let go of the pain, grief, and suffering from the loss.
That's exactly right.
Oh, yeah?
Yeah, that's right.
You know, I've talked to widows who might have lost their husband 10 or 15 years ago, and they're still referring to, well, you know, Bill today would have done this, or Bill this, or Bill that. I find that, I don't know, something seems off to me about that. Do you know what I'm talking about?
I know what you're talking about, but it wouldn't necessarily feel off to me if that's all I was hearing. Okay?
I mean, it seems like I want to say he's not here, so you're not living in the present, keeping referring to your husband and what he would do and say today as we talk.
Mm-hmm.
Do you think that's healthy? Okay?
It depends. If it is an obsessive, I can't do this, I only have to do what Bill would say,
Sure.
Then it's not healthy. If it's a sense of, this is someone I dearly loved, this is someone I shared my life with, my life and my heart and my thoughts are still inextricably entwined with my life partner. And he lives, kind of, quote unquote, in my heart and in my thoughts, and that's a way that I stay connected to him in a spiritual sense.
But if you are 75 female and this happens, to me that seems more understandable and maybe not out of whack than if you're 35 and you lost your husband and you're 50 and you're still talking like this.
Well, once again, you have to accomplish both processes, both letting go and moving on and acknowledging the reality that you have a life without the person that you've loved, but holding on. One good example, Dick, is people who have lost a child, which is, oh my goodness, probably the most painful
and the
grief
hardest
experience.
to get through.
Yes. I would never tell them to let go of their child and to not experience the presence. That's the way that holding on or relocating those emotions.
What is that transition like, though? If they first come into you and the child died 2 years ago and they just can't get out of bed in the morning without great sadness and they're sad all day thinking of this boy, what is it you're trying to do to help them? How are you trying to change the way they're living their life?
I'm trying to help them get out of bed and move on with life and realize that they are still living. They need to build a life that doesn't include the physical presence of their child that they lost.
So ideally, where are they headed? How are they going to be different? Emotionally, their thoughts about their child, how will that change?
Ideally, being able to embrace the love that they had for their child, being able to embrace the memories that they had, finding some comfort in what they had versus what they lost.
Yeah. Okay. So like we had talked about, we're trying to keep the good, but moving on your life and being able to have a fulfilling life.
Right.
Men versus women and grieving. Let's take a widow and a widower.
Okay.
Any difference in how they might grieve? Let's take two 68-year-old people.
Okay. All right. At that age. Well, without trying to feed into a stereotype, oftentimes men are a little more dependent on women to create that sort of world household environment. And so that third task of adjusting to the environment without the person you love can oftentimes be a little bit more difficult for a man than a woman.
Can I interject something here?
Yeah.
I will. There's a book, The Seasons of a Man's Life, famous book on men, written a long time ago. But he said, the author's name was Goldberg, not me. He said 4 out of 5 men, when they're asked, who's your best friend, they say their wife. Who is your other best friend? And they define friend as something more than activity companion. Nobody. Women, I doubt they'd say that. Yeah.
I agree. That's been my experience. I don't have the research to back it up.
Yeah.
Yes.
So, how about that social adjustment of widows versus widowers and letting go?
It can be much harder for men.
Yeah.
On the other hand, there are a lot more widows out there than widowers.
So they pick up another wife.
Sometimes, if they so desire, or they're open to that, they can, receive support from other from the women.
Yeah.
Right.
What do you think the issues would be as a therapist seeing a widow or a widower who can't let go? How would they be different?
They wouldn't necessarily,
No.
quite honestly. I think that there is more of a cultural challenge for men in that perhaps there's a little less permissiveness about their ability to grieve openly. But I really think that the emotional process is very similar for both men and women. And there's quite a bit of variation amongst individuals, regardless of gender. So
Yeah.
everyone, people grieve in very different ways. For some, it may be a lot of crying. For others, that may not be their way of expressing their pain, but is nonetheless
I would assume that's
deeply felt.
gender bias, too. I would think women cry more readily than men over this.
Perhaps.
Okay. How long does it take to go through the grieving process? I know you're going to say it depends, but give us some idea.
Okay. A lot longer than people think, for one
okay.
thing. We tend to be a really, sort of fast food society, and we think, okay, you get through the funeral, and people will ask about the loss for several weeks after that, and then, well, it's been a month or two, they really should move on. In fact, that's when grief is actually just starting. The funeral and those initial weeks, again, can be sort of the surreal space where the reality of the loss is not sunken in.
Sort of distracting you from the reality because you're busy with these rituals?
No, it's just the intensity. It's like emotional shock. The same way you might go into physical shock.
But it's not because of the funerals and the rituals, because it just happened.
It's because it just happened. But what people tend to think is that a death is one event, and that someone experiences it and then they get over it. In fact, grief is about a whole series of losses, and they very often occur all the way through the first year, which is why the first year can often be difficult.
What do you mean by a series of losses?
Well, for example, a person's birthday will come around. The first holidays.
Yes.
I had a widow who I worked with a number of years ago whose husband died unexpectedly in March. And she was quite emotionally distraught, went through the first 6 months, which are oftentimes the most emotionally kind of a roller coaster. And I got a call from her in early December, and she was very, very upset, and I was somewhat surprised, and said, well, what's going on? She said, it snowed today. My husband always went to work first and called me and told me what the roads were like. So she couldn't experience that loss until she had gone through the cycle of the first year. So it's a series of losses.
Sure. Let's talk about, if you could, funerals, rituals. Do they help with the grieving process?
Tremendously. Tremendously. They're a way of publicly acknowledging and our grief, our pain, and honoring the person who's died. I just think that it kind of needs to go beyond just the first week after the death.
How's that?
So, well, for example, in Judaism, which I think has some really is more tuned into grief, perhaps, than some of our other modern day cultural traditions, they acknowledge the death anniversary with a yahrzeit candle. And that can be very, very consoling and comforting, and
they do that year after year.
Year after year.
And why does that help in the 5th year to have that? I would assume you've adjusted by then. You're moving on.
I think it's a way of holding on in a good way.
Like we talked about before.
Exactly. Right.
You mentioned guilt before. When someone dies. Why would you feel guilty?
I think the psychological reasons behind guilt are that they help us to get a sense that we have more control than in fact we really do. So the guilt serves the purpose that if I had done this or that, then maybe things would be different.
They'd be alive.
They'd be alive.
Wow.
And in some ways, that's more comforting than having to deal with the harsher reality, which is we can't control things. And this is what happens in life, and life can be incredibly fragile.
I thought what you might have said was the guilt for all we didn't do while they were living, or the things we should have said or neglected to, and things like that.
People will oftentimes feel that way, which is, kind of a good anecdote, is to live each day as though the people you loved might not be there tomorrow, but most of us can't do that and can't stay in that present moment. But
finally, can you give us a little recap on when you need help, when you need to see a person like you?
Okay. I think that people can benefit from grief counseling and a professional supportive ear after many, many deaths, and that needn't be pathologized.
After many deaths?
Yes, after most deaths, for that matter.
Oh, I see.
Yes.
Yes.
That needn't be pathologized as clinical depression or there's something wrong with you. I think accessing a coach, I have a coaching business,
Right.
or another professional as someone supportive to help you get through this life transition is a healthy choice. People see a counselor after divorce. Again, it may just be this sort of adjustment period of 6 months or so and getting support. Some people have friends and a network of other people who can provide that for them. They don't need to see a counselor. However, if a person is not letting go, if they are obsessive, if they are unable after many months to move beyond the death and continue on with living, then it's really wise to seek help. I would say, be sure that you find a professional who's experienced in grief. Grief is different from other losses, and it's really important that you get someone who has that knowledge and background.
Well, Dr. Emely, we changed your name. Kind of like that for your own radio program.
Oh, sure.
Thank you very much for filling us in on this subject. It's very interesting and I think very helpful.
I hope so. Thank you for having me.
And I hope you'll join us on the next edition of Insights.